Hello and welcome to another edition of NHIS in a week. Coming up, foreign delegation visits NHIA to understudy the 19-year-long operational success. NHIS staff receive training on new digital platform. Now the detail. A team from the World Bank Global Financing Facility, the Netherlands Ministry of Foreign Affairs, Ministry of Health, Senegal, and the Norwegian Agency for Development paid a working visit to the National Health Insurance Authority last Monday. The delegation received by the executive management visited Ghana to understudy the 19-year-long operational success of the authority and learn at first hand some of the innovations employed for the sustenance of the scheme.
Because of that gap between the active membership and those who have ever been members, we introduced this innovation as well. There are queues sometimes at the district offices, and this was to make the whole re-registration renewal process seamless and easy on our members.
Deputy CEO in charge of operations, Mrs. Vivian Adokobia, welcomed the team and stated the authority's willingness to share its operational strategies.
We will articulate specific strategies for the health financing functions of revenue collection, pooling and purchasing, and how we have used technology in increasing our membership, our claims management, and improve the health service landscape. I am confident that the deliberations will be beneficial and provide a springboard for more collaborations in the near future. I wish you a pleasant stay and hope you use this opportunity to see the beautiful Ghana. Akwaba.
The team also visited the Ayawaso District Office and the Claims Processing Center of the authority here in Accra.
Stated number of people that needs to be new registrant and renewal, then we forward it through our regional office to our head office and approval is given. So when approval is given, then this is the working document. Then we go to a site or a location given to us and we register them there. Then we print it and put it on file for audit purposes. Thank you so much.
Some of the participants had this to say after their visit to the NHIA offices.
So we're here with the Global Financing Facility and the World Bank to visit the NHIS today to learn more about the scheme. The purpose of our visit is for an investors group meeting for the GFF. And as part of that, we have partners here from development partners. We have ministers of health from Cote d'Ivoire, from Central African Republic. We have members from Senegal. And we're all trying to learn a little bit more from Ghana about the scheme that's been implemented and how it relates to PHC reform. I think that we heard a lot today about the evidence base that the NHIA uses to make decisions. So we learned a lot about the actuarial studies and the work that goes into making decisions about a next phase of a benefit package, etc. So that was interesting.
Now, key players in Ghana's social protection ecosystem have completed a 2-day stakeholder subcommittee meeting that took place at Hill Palace Hotel in Piduase in the Eastern region. The subcommittee met to discuss cases from the single window citizens engagement services and strategized on the effective development of a referral pathway for case management. The National Health Insurance Authority is set to introduce My NHIS app, a new digital platform that would afford prospective members the opportunity to register onto the scheme online. As part of preparations to effectively roll out the app, a team from the NHIA led by the Corporate Affairs Directorate, Membership and Regional Operations, and the Management Information Systems Directorate have embarked on the nationwide sensitization exercise to create awareness and train all NHIS staff across the country on how to operationalize the digital platform. The Deputy CEO in charge of Administration and HR, Mrs. Yapokia Baden, remarked that the introduction of My NHIS app will not only provide convenient means for member enrollment, but will also eliminate congestion at district offices and registration centers.
I'll say as a scheme, we started with paper cards and then we moved on to the biometric membership system, that's the BMS. And um, most of our claims were manual, but I'm happy to tell you that we are about 60% this third quarter. And in 2023, we hope to achieve 100% electronic claims. So paperless is where we are going to now. Again, we have um, a portal for credentialing. Hitherto, our providers would have to come to our offices to have their credentialing approved for them, but now we have a web portal, so it makes it easier and it's accessible and it's quick as well. Again, we have had to bring up an app which we call Star 929 using the USSD code, and at the comfort of your home or in your couch, you can just dial this star 929 hash and then you can renew your membership. You can also find out whether you are valid, your validity, get to know what the benefit package is, also the drugs on our medicines list. And even the good news I have to share with you is that in November we are bringing the NHIA application, membership application, which helps people to register on this app. You just go to the Google app and download it. And anywhere in Ghana, so far as you have your Ghana card, you can just register a relative or yourself, and bingo, is going to even help us achieve our population coverage by 2030 in the shortest possible time. Aside that, we are doing a lot as well when it comes to even payment of claims. We want to go onto the gift mix so that we can pay claims on time. And so these are some of the innovative measures we have brought to bear with the scheme, and for which we are also enjoying quick access to certain information that our stakeholders would also want to have from us.
Okay, so the Greater Accra Regional Director, Mr. Bernard Brown, is optimistic that the digital platform will be a game changer that will boost membership in the region. For him, the sensitization exercise will equip staff with the requisite skills and knowledge needed in creating a convenient member experience for members.
Well, the impression has been very good. In fact, we are starting with the primary stakeholders. That is a few core staff from our district offices, and we expect that they also carry the information to the other staff, the rest of the staff who are on the ground working. And so today's program has been very fruitful. I'm so much impressed with the deliveries of those who made the various presentations, and I think it's a good start for all of us. The app is going to be a lifesaver. Most importantly, the third party registration for new registration. Third party, let me put it this way, because initially people would have to walk in to our offices to do the new registrations themselves. But then with this digital card coming in, it means that somebody can even register for you on his phone if you don't even have a smartphone. And for me, that is a very big game changer.
To our final story, the Cape Coast Metro Office of the Authority embarked on the registration exercise at the Cape Coast Stadium on Saturday during the Ghana Premier League game between Kotoku Royals and Hearts of Oak. Kotoku Royals is part of the 4 newly promoted football clubs in the Ghana Premier League. The National Health Insurance Authority has partnered for the season. Mr. Oswald Isua Mensah, Acting Director of Corporate Affairs, the Central Regional Operations Manager, Mr. Deku Utu, and some selected district officer staff were at the stadium to supervise the registration exercise. This week on Health Tip, we take a look at appendicitis. And this is how we wrap up this week's edition of NHIS in a Week. For more stories, visit our website on www.nhis.gov.gh and all our social media platforms displayed on the screen. Thanks for watching.